Hi, everybody. It's Dr. Christine Anderson, or Dr. Chris, as my patients call me. And I'm here today. We're here together, and I'm going to talk to you all about your core tonight. So this is super important. We spent the whole month talking about overall posture and then spinal health for our neck, our upper back, our lower back. And now we're going to put it all together with the core before I start going through our extremities. So we're going to dive right into this because we don't have time to waste. We've got to get our core taken care of. So what is the core? You hear a lot of this. I've got to work my core. It's important to work your core. Well, what is the core, right? It is not just your abs. It is so far from getting a six-pack, it's not even funny, because we're actually talking about very deep muscles, whereas our abs are the rectus abdominis, which are our superficial muscles, and they're pretty looking at it all, but they are not the ones that really help sort of keep us kind of glued together. So this is the area of the body, which is your midsection, basically from your diaphragm down to your thighs, front, back, side. So our diaphragm goes all the way around. And that's going to include actually the diaphragm itself, so the muscle we use to breathe, our transverse abdominis. What the heck is this? This is a very deep abdominal muscle that is actually down in the lower pelvis. So I'm going to stand up so you can kind of see, but it's way deep down here. It's not superficial. It is deep, deep down inside. Our erector spinae, what the heck? These are the muscles along our spine, and they are the ones that help keep us upright. Our obliques, so these are the ones on the side here that kind of give us our waistline. Our pelvic floor, so that's deep down underneath our pelvis, as well as our lower latissimus dorsi, and that's the muscle back here that will take our shoulder blades and drop them down our back, and our gluteus maximus, which is basically your butt. And I am not going to show you my gluteus maximus today, but these are the muscles that work as stabilizers for your entire body. And this is why core training is really just doing specific exercises to develop and strengthen these stabilizer muscles. Because if any of these core muscles are weak, it could result in back pain, bulging waistlines, and you can also be more susceptible to injury. So the research has shown that athletes with higher core stability have a lower risk of injury. And this can be for you too, even if you're not a professional athlete. So keeping those core muscles strong is going to do wonders for your posture and help give you more strength in whatever you're doing, whether you're a mom, lugging your baby and things around, or whether you are an executive and you are sitting all day, or if you are participating in exercise or particular sports. Core exercises are for everybody. So I talked about the executive or the person who's sitting a lot, and this sedentary lifestyle has led to so many of us having a weak core. Whether we're sitting in the car or sitting at our desk or sitting watching TV, a lot of sitting is going on. And this is a modern day problem because our ancestors moved their bodies continuously and worked hard from sunrise to sunset doing labor intensive chores. And I think about this, right? If you think about making a meal and being in the kitchen, how many modern day appliances we have, or the things we can just pop over to the store to get. So from like grating things or mixing things or chopping, so many things now, blending, all of these things are automated. that we don't have to do so much hard work? Or what about in the times when they churned their butter by hand? I mean, crazy, crazy upper body strength. Or kneading their bread by hand takes a lot of work and energy. That is a workout. I swear, if you really, really want to work your core, toss your modern day appliances and you will get like the workout of your life. All right, so if we're not going to do that, we're going to do these other things. We want to have time to do the other things in our life, right? At least I know I do. So keeping your torso strong is important. It's your center of power, and it really doesn't take that much time out of your day to work on your core strength. And I often advise my patients just to take breaks from whatever they're doing, especially if they're sitting a lot. So you should be getting up and moving your body if you are sitting. And if you're not, and let's just say you're a mom and you've got your kids, get on the floor and do some of these things, and they'll probably climb on top of you, which will work it even more. And before you know it, your strength will be really strong. All right, so 5 signs that your core is weak. And we're going to talk about what you can do about this too. We're going to talk to how you can test to see how your core strength is, because you have to know where you are to know where you're going. But if your back hurts, which is a common side effect of a weak core, that is definitely a sign that your core is weak. Any back pain, whether it be neck, upper back, lower back, mid back, any type of back pain, your core is probably weak. You have poor balance. So whenever you have poor balance, you are going to have to compensate. And in that compensation, you're going to have to use a lot of muscles that you wouldn't normally need to use if your balance was better. I talked about poor posture being a result of a weak core, but when you have poor posture, that's going to kind of also create a weak core because you're not using the muscles you need to use. So it's sort of like a wheel churning, right? So you can go on my episode of just optimal posture to check out what I'm talking about with postural issues. And I'll put a link in the description. So a good core is going to make it easier to have really good posture. And that is then going to become more effortless the more you start to do it in a positive way. One you might not think of, wrist and foot pain. So if your core isn't working to keep you stable, then your feet are going to have to work harder. That's going to tax the structures of the feet and calves, as well as the fascia on the bottom of your feet. So that's another aspect. And this is a really interesting one too, is holding your breath. So remember I talked about your core starting at your diaphragm, which is right at your lower ribs. And that is your main breathing muscle. So when your core lacks stability, you actually have to use that diaphragm to have support of your core, which means then it can't be used to breathe. So you're going to find that you're holding your breath. And one of the most telltale signs of this happening is that you're holding your breath during exercise. So also check out my episode on optimal breathing, because you're going to want to know how to do that too. All right, let's get right down to testing your core strength. We got to know where you're at so we can know where we're going. So you're going to do something called a trunk stability push-up test. Now, I am going to do a separate video that shows these, but basically you're going to lay face down on the floor. You are going to put your hands in this position. So this is the floor right here. You're going to put your hands in this position with your elbows tucked in, but your hands are underneath your chest, right like this. You're going to tuck your toes under. And then you're going to scoop your tailbone under and actually lift your abdomen off the floor. So basically, you're just on your hands and your feet and a little bit on your chest too, tailbone tucked in. And then you squeeze the bejesus out of everything and you push up into a push-up position. It's super hard, folks. I'm not going to lie. I can do it. I don't want to do too many of them because it is hard, but all you have to do is one to pass this test. And that means most of the time people want to lift their chest up first and then their butt comes up first, but you want chest and butt all to come up at the same time. And I promise I will put a video on this I really recommend subscribing so that you know when I post exercises, because basically I do them whenever I can fit them in, and then I post them all at once. All right. So single motion to perform that push-up without letting your body sag along the way. All right. The next core strength test is your plank and your side plank. And these are evaluating your core static strength. So plank is going to be done on your elbows. You're going to put your elbows right underneath your shoulders. Hands are on the ground. So again, this is the floor. And ideally, you are going to start on your knees and your elbows, engage your shoulder blades, raise your knees off of the floor, keep your body completely in a plank. If this is impossible for you, then you'll evaluate it on your knees. And then you know that that's where your starting point is, because you're going to try and hold this for at least 90 seconds is optimal. I'd say 60 to 90, but you want to aim for 90 if you're going for the full on test. That is regular plank, side plank. Your elbow's going to be under, here's the ground here. My elbow's going to be under the shoulder. And you're going to raise your knees off the floor, lift your hips so that they're in alignment with your body. Squeeze your butt, pull your navel into your spine, and you are going to stack your feet on top of each other and maintain that alignment for 60 seconds. That would be a pass, or you would note how much time. For your back core, you're going to do the bridge. This is the one where you lay on your back, bend your knees, get your shoulder blades underneath you so chest is lifted, and you lift your hips up. And again, it's a straight line, so you don't want your hips hanging down lower towards the floor. You want to really push them up to the ceiling. I for sure will be doing a video on this as well. You are going to hold for 60 seconds with both legs, and then you're going to lift one leg up for 30 seconds, put it down, and lift the other leg up for 30 seconds. This is the test to see if you can actually hold this particular pose for 60 seconds with both feet, 30 with each leg. The last actually, it's not the last test. The last static sort of test is the Superman. Now, I like to do this laying on my belly with my feet on the ground. You're going to see many Superman where they lift the feet and the arms up. I actually like to keep my feet down because it's going to make you work your back harder, but you can actually engage your front core a lot easier, and it's going to be way harder to lift your chest up too. This is going to really help. A lot of people think that this is going to put too much stress on their lower spine, but if you do it properly, it's actually one of the best things for your back pain. And I can attest to that because this is one that's really hard for me, and it is really one of the best ones for me. So, I graduated from doing it on the floor to now being able to balance on a trapeze. If you don't think that is hard, go try and do it. This is going to work your glutes a lot and your hamstrings. You're going to try and hold this for 60 seconds where you're laying on your belly. Optimally, your arms are going to be overhead. If you can't do that at all, then you try going to the side. And if that's impossible, you bring your arms down the back and reach towards behind you. So you're going to also make a note at which level you can do it. This is the hardest, medium, easiest, okay? Because at that point, wherever you're testing, that's where you're going to start with doing your exercises. Now, the next thing we're going to do is assess your dynamic core. This is where a lot of people miss the boat when they're working on their core. First, they miss the boat working on their back core enough, which is your Superman and bridge. And they're working too much the front core with sit-ups and whatnot. I don't do any sit-ups, but what I do is these either knees to chest or toes to bar, which is a control of core strengthening during abdominal flexion, meaning you're using your lower ab muscles to bring your knees or legs up through this full range of motion. Now, I've got a thing going on with my hip flexors, so I tend to stick with the knees to chest. I can do a toe to bar, but it puts a lot of stress on my hip flexors for me at this moment in time. So what I do as a compensation is I'll bring my knees up, then I'll extend my toes up. And this is something I will show you either on my pull-up bar or trapeze. Again, I plan on doing it soon. It's more likely than not that I'll do all these exercises at one time and just kind of knock them out and post them. So it will happen, I promise you. So you want to hang from a bar, pull-up bar, whatever. Go to a playground. Doesn't matter. You just need to be able to hang. This is a passive hang where your shoulders just squeeze up by your ears. When you do this, you want to engage your shoulder blades. I'm using my lats a lot to pull my shoulders down my back. This is great anyway, even if you just hung there. And then you're going to either bring your knees up towards your chest, or you're going to bring your toes up straight to the bar. And you're going to do that 5 times for an optimal score. All right? Okay. Don't swing, by the way. So don't like do a back swing to get your legs up. That's cheating while you're testing. Okay. So we've tested, you see where you're at. You see, A, if you can do these exercises. B, you can see how many you can do. Do you need to make these accommodations, whether it's being on your knees for that full push-up test, or do you, for the same thing for the plank, do you need to get on your knees? So just note where you're at, because that is where you're going to start. If you had any pain while you're doing these exercises, please stop. Don't keep doing it. Pain is a message. It says, hey, something's going on here that needs to be checked out. So go consult with the appropriate professional. Of course, I am biased. I am a chiropractor. We are so well suited for musculoskeletal issues, even though that's not the only thing we can do. Specifically, you want to find somebody who maybe is more versed in exercise, maybe a sports rehab person, or they themselves are an athlete, especially if you're having a particular sport. So that's why aerialists like to come to me, because I do aerial arts and they know that I get it and understand what muscles they're using and some of the issues and problems. Whereas if you don't practice aerial arts, you have absolutely no clue. So yeah, you want to get some support if you have any pain to make sure that you are working with optimal alignment and you're not going to injure yourself. You want to help yourself. Okay, so just go get some help. Some things you have to have support, right? So you're going to begin this program based on your results from the screening and the tests. And if in doubt, you start slow, right? Go conservatively and advance from there, because you don't want to do, A, you don't want to strain anything. And B, if you're not doing it properly, then you're not going to get the results. You're not going to get the benefits. So it's not just pushing it through to do a minute plank. And I see way too much of this. If you are not engaging the right muscles to do that core exercise, and you are compensating for other muscles that are already strong, like a lot of people compensate here in the chest and they push away from the floor instead of using their core, you're not going to go anywhere with it. It's not going to do a damn thing. And you're just going to create other issues, because then it's going to be all tight in here. So a good place to start is my video I did on the 4 basic core exercises. I'm going to put a link so you can just go right to it. And that's going to give you your plank, your side plank. And I do put variations in there, so you've got places to start if you don't have all that strength. There's going to be boat and there's going to be Superman. So I do need to add bridge, so I will do that video soon. And I will show you some of those other core tests that I talked about as well. You want to make sure you're having enough breaks in between, so you can either stagger what you're doing for your core if you want to do something every day, or you can just make sure you have enough rest in between, at least a day or two, but maximum of 3 days. You don't want to go much longer. So you're going to just build up the time as you train for longer and longer periods until when you retest, you can do everything optimally at its maximum. And then you want to keep maintaining that. All right. So when you get that core going and you want to keep it going, but it gets kind of boring to keep doing the same core exercises, even though I still do, but I mix it up. I add stability balls, I add foam rollers. Of course, there's things I do in the air on trapeze and silks to work on my core. So I'm kind of keeping things fresh and almost even cross-training my core workouts because our bodies do get used to this stuff. And then you can try doing some dynamic core sports. Then you're training for maybe a goal like rock climbing or aerial arts or martial arts or capoeira or boxing, acrobatics, gymnastics, cross-country skiing, swimming, rowing, kayaking. These are the types of sports that use our entire core. All right, we did it. So we made it through. You know why it's important. You know how to test what your core strength is. I'll be putting up more videos to back that up, showing you exactly how to do the testing. And then you've already got to start those 4 basic core exercises that anybody can do with the accommodations. So you can get going on your core like now, seriously, like right now. All right, thank you everybody. I hope you have a great evening. If you like what I have to say, give me a thumbs up, share this with your friends. Everybody needs a strong core, remember? And please do subscribe so that you will know when I post videos, there won't be any guessing, and then you can get all the things that I promise you. And if I promise something, it will be happening. I just don't know when. All right. Thank you for taking the time to watch this video so that you may enjoy optimal health and an optimal life. And I will see you next Tuesday.